This is the Muslim culture presentation provided by Heidi Borowski, Kelly Gurman, and Tanita Johnson. This presentation explores the cultural factors related to the Muslim population, health and illness beliefs, common stereotypes, local health facilities, barriers, bridges, and recommendations to enhance culturally sensitive care. Cultural factors related to the Muslim population include interpersonal relationships, communication, religion and magic, social systems, dietary food habits, and values. Extended family often share a home. There's a great deal of respect shown for all. Women are typically subordinate to men. The men make the decisions. However, in the home, the wife has an influence in family matters, especially relating to childcare. Males and females who are not related should not touch, make unnecessary eye contact, or be alone together. Public displays of affection among married couples is discouraged. Publicly, marriage is formal and respectful. Pain related to childbirth is a source of respect for mothers. An extended family provides support when someone is sick. Respect continues over in the way Muslims communicate. Muslim Americans often speak English, while traditionally the language spoken is Arabic. When women are in public, they are expected to speak quietly, so strangers do not overhear them. Conversely, communication during labor and delivery of a child is not quiet, but rather loud and very expressive. Expression of pain is acceptable and expected. Communication between males and females should be limited and to the point. In addition to unique communication styles, Islam is the religion followed by more than 1 billion Muslims. Allah is the God worshipped by Muslims, and the Quran is the holy book. Muhammad is the prophet and founder of Islam. Islam means submission to God. The two main religious orthodoxies of Muslims are Sunni and Shia. Fundamental beliefs are called the Articles of Faith. The 5 pillars of Islam consist of a declaration of faith, prayer 5 times daily, at dawn, noon, afternoon, sunset, and night, fasting, charity, and pilgrimage to Mecca at least once during a person's lifetime. Religious objects such as an amulet with sections of the Quran attached should not be removed from a patient. In addition to amulets, religious objects include prayer rugs. Nothing should be placed on top of these rugs, and they should not be touched by anyone who is considered unclean from a religious, ritualistic standpoint. In addition to the socially unique qualities of Muslim culture, there are dietary guidelines followed as well. Consumption of any pork products, including hidden sources from gelatin, insulin, heparin, are to be avoided unless medically necessary to sustain life. Alcohol and drugs are prohibited. Meat consumed by Muslims may need to be slaughtered in accordance to halal process. Halal is a process permitted by Allah for meat processing and preparation. During Ramadan and other religious observational days, Muslims do not eat or drink during daylight hours. Exemptions from fasting are allowed when medically frail, and one may feed a poor person or fast later in the year to make up for missing this occasion. In general, Islam provides a healthy plan for living, allowing many Muslim adults to follow these practices and lead a relatively healthy life by avoiding illnesses caused by overconsumption and drugs and alcohol. Some of the values that Muslims find important and help define their culture are prayer, cleanliness, modesty, and respect. Prayer is a daily ritual performed 5 times a day while facing the direction of Mecca. Cleanliness is significant and must be done before a prayer. Muslims believe that the left hand is dirty and should be used for toileting, while the right hand is clean and used for eating. It is customary to remove their shoes before entering their home, and modesty for Muslims is expressed in their personal interactions and in the way they dress. Respect for elders is a priority for Muslims. In addition to Muslim values that promote wellness, there are other significant health practices of the Muslim population. Health is considered a blessing from God. Illness is also a blessing as it enhances your spirituality and brings you closer to God. Muslims prefer a medical practitioner of the same gender. Mental illness is not socially acceptable and has a stigma attached to it. Often, somatic complaints will be expressed when really there's a mental illness or depression. Prayer and spirituality have been found to have a protective effect for mental illness. Cleansing rituals have been shown to result in lower bacterial levels in the nose and in the body that are performed before prayer. Studies have found this to be protective and reduce the number of peritonitis infections by those with continuous ambulatory peritoneal dialysis. Additionally, vaccines are acceptable. Women of Muslim culture prefer female medical personnel, but may use male medical practitioners if necessary, due to female modesty. During childbirth, devout Muslim females increase their reliance on God to help them give birth safely. Pain is expressed freely. Babies are breastfed until 2 years old. Colostrum is seen as a detrimental for cultural, not religious reasons. When breast milk is donated, the donor and recipient are considered related and cannot marry. Solid food is started at 6 months. Reproductive practices of the Muslim followers are quite simple. Birth control is agreed to by the husband and wife on the advice of the physician and is an acceptable practice. Abortion is prohibited. According to a research study, there is a negative stereotyping of Muslims as potentially violent, fanatical extremists, as seen by Americans. Due to this common stereotype, Muslims have found it difficult to merge into mainstream U.S. society. They've also found difficulty in maintaining their identity as Muslims. Contrary to this stereotype of violence, Muslims place a high value on benevolence and conformity, while generally disdaining such Western values as power, hedonism, and excessive stimulation. Additionally, the belief that all Muslims are from the Middle East is not accurate, as only 20% have this origin. Muslim Americans are 30% white, 23% Black, 21% Asian, 6% Hispanic, and 19% of other origin. The healthcare facility researched was Sisters of Charity Hospital in Buffalo. The barriers to care, the bridges in place, and recommendations to facilitate culturally congruent care for the Muslim client are further examined. As a Catholic health facility, the mission statement says, quote, "We are called to reveal the healing love of Jesus and those in need," unquote. At this facility, there are barriers to culturally sensitive care. First, language is a huge communication problem, beginning with the signs at the front doors of the hospital. All signs and directions are in English. The hospital website is available in English and Spanish only. There is a need for improved cultural awareness, interpersonal communication, gender issues, food preferences, privacy and modesty to faith practices. Muslim spiritual life and prayer is a high priority. The fact that Sisters is a Catholic hospital is a barrier. The hospital has a chapel only offering Catholic services. Patient rooms often have a crucifix or pictures of Jesus on the wall, and nursing staff is predominantly female, and it may be difficult to provide men with male medical personnel. Bridges that are available include a video remote interpreting service where portable computers offer live, web-based conferencing with an interpreter from their culture. Sisters also has a spiritual care department that offers chaplains from various faiths to provide counseling and prayer to any religion. Copies of the Quran are also available to patients if desired. To maintain privacy for the Muslim patient, private rooms are available for patients. The organization is also encouraging staff to further their education, which includes cultural awareness. In one study, Muslim patients, the participants related concerns and dissatisfaction over the healthcare workers' absence of active listening skills, clarity in treatment explanation, lack of interpreter services, and lack of interest in the personal story of the client were all deterrents to the patient's decision to participate fully in the healthcare decision-making process as it related to care. Specific recommendations for provisions Sisters Hospital could implement to provide culturally sensitive care to the Muslim population Begin with consideration of the hadiths. These sayings by Muhammad are considered accessory knowledge that may provide guidance to general healthcare beliefs and medical ethics desired by Muslim people to receive culturally congruent care. Some recommendations to bridge the cultural gap include addressing the need for gender concordant care upon arrival to the hospital, not just when they are admitted to a medical unit. Additional attention paid to privacy and modesty, allowing women to cover their bodies as practiced, and having signs restricting males and female patient rooms, including halal foods on the menu and offering a neutral prayer space, which show respect for the Muslim culture. Additionally, research has revealed a need for improved active listening skills of medical professionals and would be recommended for this facility as well. Those who practice Islam, the Muslim population, observe the teachings of the Quran. The teachings provide clear guidance to Muslims for conduct in private and public. Muslim follows cleansing and prayer rituals 5 times daily. Women are considered subordinate to men, and much is done to separate genders to protect women, children, and the family unit. Modesty in dress and conduct is expected. Moderation is promoted in all areas of eating and living, forbidding alcohol and drugs. Stereotypes of the Muslim culture portrayed a belief that Muslims are violent and all Muslims are from the Middle East. However, Muslims place a high value on benevolence and conformity. The belief that all Muslims are from the Middle East is not accurate, as only 20% have this origin. Respect of one's role in upholding the values of the Islamic teaching is important. Language, lack of cultural competence, and lack of respect for gender modesty are evident in society and are the primary barriers to obtaining health care and are the basis for the recommendations of the changes to be made to Sisters of Charity Hospital in Buffalo. Recommendations included gender concordant care for privacy and modesty, including halal foods, offering a neutral prayer space. By following the hadiths, sayings Muhammad, guidance to general healthcare beliefs can be derived. Implementation of these recommendations for medical professionals would promote culturally congruent, competent care in a safe, non-threatening, welcoming environment, bettering the physical and mental health of all clients, including Muslim Americans.